All right, so we're going to look at the temporal area and for smoothing the temporal crest, which is not her main concern, but we're going to look at the technique of smoothing the temporal crest. We have to realize that this is a bony ridge where there's a transition between the frontal area and the temporal area. And you can really palpate it with your finger, so I'm a little bit lateral here. And looking at the anatomy, the danger here is the superficial temporal artery, and sometimes it's really making a loop over this area. You can see that there's a vein here. That's of course not as much of a risk as the superficial temporal artery. So we really have to feel for pulsation, palpate for pulsation in this area, because we're going to use a sharp needle to smoothen the temporal crest. Okay, now I feel a pulsation, so that pulsation is right here. So I'm just gonna stay away from, I'm just gonna stay inferior to this line, actually inferior to the hairline. So basically in her, the superficial temporal artery is like it is drawn in the anatomy books, but often you see anatomic variation, and lots of times the superficial temporal artery may be right here at the area where you want to inject the filler. Can you raise your brows? Yeah. So the frontalis muscle, you can relax again. The frontalis muscle runs usually a little bit further than the temporal crest, so a little bit more lateral. So what I'll do, and I'm going to use a sharp needle for this indication with non-diluted calcium hydroxylapatite, is what I'll do is I'll go with my needle tip with a bevel down straight to periosteum, but under an angle. So I go through skin and I advance my needle below the muscle until I reach the temporal crest. Now the needle tip is in contact with the temporal crest. Aspiration is absolutely unreliable. I could wait for a minute and still with this needle and this product I wouldn't get any reflux. So it is something that you can do, but if you have a negative aspiration, as you see now, it doesn't mean anything. So what I'll have to do is I'll have to be smart when injecting, and that means small amounts, 0.05. Without taking the needle out, I re-advance it to the temporal crest, but a little bit higher. And again, slow injection, 0.05. And also down here, I will put my needle at the temporal crest and inject 0.05. As you can see, I have a little bit of a needle block right now, so I'm not going to force it. I'm going to take it out, even out the product that I've just injected in 2 boluses of 0.05. And now I can check if I can get that little piece of tissue out of the needle. Yes, I can. So I can either change the needle or reuse this one. We have to realize that the more often we touch periosteum with the needle, the more blunt the tip will become. So when you go through skin, it may become a little bit more painful. All right, so I've re-advanced the needle to the temporal crest, 0.05. Retract, reorient, re-advance. Let's see, where are you? Here we go. And 0.05. And touching periosteum, 0.05. And 0.05. All right. So I think, you know, given the fact that she has a relatively small problem with hardly any sharpness, this is already a good result for her. Now we may expect some swelling. because this is the undiluted form and it's been injected on top of the periosteum, so it might swell up a little bit after about 5 to 10 minutes. And then continue for the next few hours, and sometimes even the next morning the patient will see that there's quite a significant swelling after placing this product with the needle on periosteum.